is Kirsten and I'm going to be your nurse today. Do I have your consent before I start this focus assessment?
Yes, you do.
Okay. The consent will be sent to my instructor via email before I submit this. Okay. What's your name, date of birth, and where you are right now?
It was Matt Gleason, and my date of birth is 5/14/97, and I am at Kirsten's house.
Okay. Do you need any assistive devices, like glasses or hearing aids, etc.?
No.
Okay. Do you have any pain right now?
No.
Okay. I'm going to ask you to remember 3 words. Bird, cat, and zebra.
Okay.
Can you repeat those back to me right now?
Bird, cat, and zebra.
Okay, and I'm going to ask you again at the end of the assessment, okay?
Mm-hmm.
Looking at the patient from head on, his eyes are symmetrical, and his nose and ears are symmetrical. There's no obvious signs of any lesions, redness, swelling, or any pigmentation differences. And now I'm going to just look at your scalp. I would put on gloves and hand sanitizer before I look at the scalp, just so I don't want anything to happen. His scalp is regular. There's no signs of any critters, balding, redness, or lesions. His hair is moist and soft, no breakage or dryness or dandruff. Can you look straight at me? I'm going to assess your pupils. Okay.
Mm-hmm.
Do you have any sensitivity to light?
I do not.
Okay. His pupils are equal and responsive. And then just look at the pen. And the confrontation test is normal. And now I'm just going to have you look at my pen light again. The 6 cardinal fields of vision are normal, and you can see in all of them. Can you look up for me? I'll wash my hands again before I touch his face. His conjunctiva is normal. There's no signs of drainage, redness, or swelling. And his sclera is also normal. I'm going to now look at your nose. Do you have any problems with the ability to smell?
No.
Okay. Can you plug one nostril and smell? And now the other? Okay. His patency is normal. His nostrils are symmetrical. There's no signs of abnormal drainage or lesions or dryness. Can you open your mouth and say ah for me?
Ah.
And put up your tongue like this. His mouth is nice and pink and moist. There's no signs of lesions, drainage, or any abnormalities. His teeth are white and straight and symmetrical. And his uvula was midline and present. And tonsils are present. Now I'm going to just take a look at your ears. Excuse me. Okay. There's no signs of any lesions, redness, swelling, or any objects invading his ear canal. And now going to test your sinuses. Let me know if you have any pain throughout this, okay?
Alrighty.
Can you open up your mouth for me and close? TMJ is not present. And now palpating his trachea and his thyroid, which is normal. Can you swallow for me? Do you have any difficulty swallowing when you did that?
Mm-mm.
Okay. Head straight. I'm now going to palpate his carotid arteries and then listen for any bruits. Doing one at a time so I don't block his perfusion. Both carotid arteries were equal, no signs of weakness or bounding, and the beat is regular. I'm now going to listen for any bruits. When I do this, I'm going to have you hold your breath when I put my stethoscope on one carotid artery. Take a nice breath, and then I'm going to do the other, okay?
Alrighty.
Turning the stethoscope so I can listen with the bell. Okay, I'm going to just palpate the artery again. Okay. Now hold your breath. Okay. Breathe. Palpating. Turn it again. Hold your breath. Alright, now breathe. No bruit was heard, which is normal. And now I'm going to assess the temperature of your face. You're nice and warm and dry. No signs of any abnormal sweating or anything like that. And his skin color is normal for his ethnicity. Now I'm just going to have you put your hands in front of me like this. Go up and then go down, testing for strength. And now just squeeze my fingers. Strength is 5 out of 5 in his upper extremities. And now I'm going to just do light, I'm going to assess your sensation. So when I put my hands down, just let me know if they're equal on both sides, okay?
Okay.
Or any differences or pain.
Equal.
Okay. His upper extremities are dry. Not dry. They are warm to touch and normal. I'm now going to assess your nails. His nails are round. They have the half moon shape, which is normal. And now I'm going to assess your capillary refill. Okay, capillary refill on your hands is under 2 seconds, which is a normal finding. And now I'm going to just touch my pen to your arm. I'm gonna touch this pen to a part of your body. Let me know where it is. I'm gonna have you close your eyes, okay?
Mm-hmm.
This is assessing light touch.
Hand.
Which hand?
Or right.
Okay.
My left forearm. Right bicep. Left bicep. Right forearm. Left hand.
Okay. Thank you. I'm now gonna have you. I'm just gonna have your legs straight forward. We're gonna do the same thing with your lower extremities. So I'm just gonna feel. Let me know if you have any differences in any sensation.
Nope.
Okay. He has a lesion on his left foot. The borders are regular. Signs of healing are present, and there's no drainage at this moment. I'm now going to assess his capillary refill on his feet. His toenails are nice and round. Shape, capillary refill is under 2 seconds. And his skin temperature in his lower legs are warm and dry to touch. Now I'm just going to do the same light sensation. So I'm going to use my pen. Close your eyes and let me know what I'm touching.
Mm-hmm. My right thigh. Left calf. Right heel. Left foot.
Okay. And now I'm going to assess the strength in your legs. So just push up against my hands and down. And I'm going to do your feet. So feet out straight, hun. Push your feet back against my hands and forward. Strength in his lower extremities is 5 out of 5. Now I'm going to have you stand up. And we're going to can you just touch your fingers to your thumb for me? fine motor coordination is present in his upper extremities. Now I'm just going to go behind you. I'm going to palpate your spine to see if you have any signs of scoliosis. Can you just bend down and touch your toes? And go up slowly. Can you just do it one more time? And go up slowly. Okay. There's no signs of any deformities in your spine. Spine is regular, and no signs of scoliosis noted. Now I'm gonna just have you put your feet together, arms to your side. Okay. No, there's no obvious signs of swaying or anything. Now close your eyes for me. This is the Romberg test. I'm testing to see how his posture and his gait is. His posture is upright and straight. No signs of obvious swing. Now you can open your eyes. Gonna just have your hands up to your sides for me. And I'm gonna just have you touch your nose. And with the other hand. Now close your eyes and do that for me. Okay, relax. Patient's balance is intact, and his gross motor coordination is intact in his upper extremities. Now I'm just gonna go behind you. Again, I'm gonna just whisper in the back. Can you step forward for me, hon? Thank you. I'm gonna whisper in your ear and let me know what I'm saying, okay?
Mm-hmm.
This is assessing your hearing.
Hello. What up?
Patient's hearing is intact, and while I'm behind you, I'm just gonna perform the peripheral vision test. Let me know when you can see my fingers.
Right now.
Okay, patient's peripheral vision is intact. And now I'm just gonna assess your range of motion in your extremities. So just hands first, roll your wrist for me. Okay. No signs of cupperness noted. Now move your elbows. Okay. And now up, and then down to your sides. Patient's range of motion is 5 out of 5. No signs of crepitus noted, and everything is normal. And I'm going to have you sit down, and I'm going to assess your range of motion in your legs. Can you put your knee out straight for me? And then down. No signs of crepitus in his right knee. And I'm assessing the left, up, and down. No signs of crepitus in his left knee. Now ankles, just roll them for me. Crepitus noted in both ankles. That is okay. Now I'm going to have you lie down on my couch for me. And I'm going to assess one hip at a time. So I'm just going to have you elevate your hip to the sky, and then, yeah, into the side. Okay. Now, can you stand up and go to the other side? No crepitus noted on his right hip. Now I'm assessing the left. Up. And to the side. Okay. No signs of crepitus or any abnormalities found. You can sit up straight for me. Just getting one last look at the patient. Everything is normal as stated before. And can you repeat those 3 words that I said at the beginning of the assessment?
Cat, zebra, bird.
Patient's memory is intact. End of assessment.